Are you tired of quick fixes that promise transformation that leave you feeling more disconnected from your body than ever? Welcome to the Beyond Medicine Humanized Care for Women of Influence, where we go deeper than surface level solutions. I'm Dr. Maria, a functional integrative physician specializing in women's health, metabolic dysfunction, and hormone balance. Here, we will uncover the root causes of insulin resistance, PCOS, thyroid, and adrenal issues, and explore how trauma, stress, and anxiety impact your well being. Because your body is not a microwave, it deserves personalized, compassionate care that honors its complexity. Let's embark on a journey to reclaim your health one conversation at a time. And today with me, I have Amada. She is a massage therapist, the owner of Massage by Amada. And today we're going to be talking about massage for us ladies, and specifically in the prenatal and the postnatal stage of life. So, welcome to the chat today, Amada. Do you want to start just by introducing a little bit about yourself, who you are, what you do, and if any kind of a fun fact about you?
A fun fact. Okay. So, hi, I'm Amada. I've been a licensed massage therapist in the Houston area since 2018. And last year, I decided to launch Massage by Amada so I can offer massage services through my own way in order to expand accessibility to massage services in the Houston area and just with community events that I do and with my clients, just educate them on why massage therapy is so important for your health and your stress levels and your wellness. And a fun fact about me is that I grew up in Arizona. So I grew up in Phoenix and I was brought to Houston in 2011. So I've been here for 15 years now. I didn't think I was going to stay that long, but I got here, started teaching, and then after teaching, I wanted to just shift my career. And that's when I started thinking about going into therapy. Just, I was just like, you know what, I've thought about this. It's something that I grew up with as well at home with having a sobador or a sobadora, like someone that would massage in my family. And I was always intrigued by that. And so I was like, what if I actually go to school for this and learn it and see how it goes for me? And I love it. I've been in it on and off since 2018. And it's something that I'm so passionate about and so lucky that I found and can do for
Uh,
so many people.
that sounds awesome. If you don't mind asking me, what is the one thing that you like or enjoy the most about being a massage therapist?
I think just providing that healing touch is what's
Mm,
important for me. I think that's something that nowadays is hard for a lot of people to gain on a daily basis or even to just accept. And human touch and that connection is so important to ourselves as beings. It's something that our ancestors had a lot more. And it's something that I like bringing into my massages is them feeling that healing touch during the services and the benefits of that for your stress levels, for your well-being.
healing touch.
Yes.
So, as we start to dive into the topic of
Mm-hmm.
massage, right? And you have
Yes.
mentioned healing touch a couple of times.
Mm-hmm.
So, can you tell our listeners what do you mean by healing touch, right? Because
Mm-hmm.
you can be touched in a lot of different ways by a
Yeah.
lot of people. But I love having massages. And I will say there's a couple of things that I like in my massage. So one is I do prefer silence. Please don't be talking to me
Mm-hmm.
all the time. And not necessarily that you have to have relaxing music and relaxing smells, but yes, I definitely prefer silence. And then I am all about, I want you to, yes, give me a massage, but then at the same time, there's something about don't necessarily expose all of my body and then
Mm-hmm.
make me cold. That just doesn't feel right. And So let me know if you're going to do something that perhaps you might sense that could be invading to me, because I like to know that ahead of time. And
Mhm,
I like to have some sort of maybe control or permission over what's being done.
mhm.
But I think that having a massage every so often, and perhaps you can even tell us what you recommend, is it's essential for your overall health. So going back to my question, what do you mean by healing touch? And what is it that when you are telling and talking to one of your clients that you are providing to them by that healing touch?
Yeah, I think one of the big things is just listening to what the client wants. That's something that I
Mm,
always do is why are they here for the massage? And taking what they say and incorporating that into my massage. So if they're like, these are the specific areas I want you to work, besides doing a full body massage, I make sure to take extra time in the areas that they told me. And I think through there, putting my healing touch is if I feel an area of tension, an area of stress, or where they like, yeah, like this area can be painful sometimes, just communicating with them as I'm massaging. Is this feeling comfortable? Does it feel uncomfortable? Let's breathe through it. And also just checking in with them, like you said, making sure that they feel some sort of control over the massage service. And I definitely feel you on the talking. It's something that I'm like, I ask my clients, I'm like, do you prefer silence? And if it's talking, it's more just me like acknowledging what they're speaking on, not really trying to further engage. Because I also want them to just release their mind as well. But I have had instances where the person needed to just engage in a conversation because of maybe what they were going through at the time. And for them, feeling my purposeful, intentional touch just through them talking helped them relax through the
mm,
process and de stress. And yeah, there's a lot that can happen. And I think that's something that you need to look for in a massage therapist. Are they listening to what my needs are? Are they letting me feel some sort of control or safety over this process? Because, like you said, it's a very intimate process with laying on the table with a minimal amount of clothes. You want to feel safe. You want to feel that they're respecting your body. And that's
mhm.
everything that I keep in mind and that a good massage therapist will keep in mind as well.
Yes.
Yeah.
And I think that when so you mentioned like relaxation.
Hmm.
And I think that safety for anybody is going to be
Yeah.
super important
Hmm.
so that they can actually relax
Yes.
and let go
Yes.
independently of what's going on. And when I say relax, it's not only relax of their body. I think that there's also the relaxation of the mind and
Mhm.
the thoughts that can be going on that by itself sometimes can start to generate a lot of cortisol, right? A lot of the
Yes, yes,
hormone of
yes.
the adrenalines, because I'm thinking of everything that I need to do. And and I think that also providing some care to perhaps like the soul, right,
Mhm.
of
Yes.
the person in this entire process. Now that we have spoken a little bit about this healing touch, the importance of listening, creating a safe environment, and that you as a person feel comfortable with it. And I'm going to say not only comfortable with it, myself, I have done this a couple of times where I hop from massage therapist,
Mhm.
different reasons. But as I speak with you, I think that with a massage therapist, you should try to develop a relationship, like a
Yeah.
relationship,
Yeah, definitely.
yeah, with other health professionals. So talk to us about what are some of the reasons that perhaps women should think about incorporating massage into like their self-care routine
Mhm.
from a health perspective, and that perhaps go beyond the, oh, I want to relax.
I think one of the ways massage promotes healing is through increasing the circulation in our bodies. And so with that circulation, you're getting your lymphatic system activated a little bit more. You're getting the blood flowing through your body, and just our blood has so many healing properties.
Mm,
And sometimes, depending on our lifestyle, that circulation might be limited or not as often as you would like. And so, incorporating massage on a monthly basis bi-monthly or even like once every couple months definitely helps to just get that blood flowing, get that lymphatic system going to help just your body release just different toxins that it has inside. And also just in terms of tension management, sometimes pain management, just from like everyday things, just sitting at a desk, walking or standing, providing that manipulation to the muscles definitely helps with releasing, with like just moving it around, like moving the fascia around, moving that mobility. I also do some stretching as well. I know stretching is something that has come up a lot as the benefits to it. And so I think they go really well together just to get your body moving.
Yeah.
Yeah.
And to get the body, when I think about getting the body moving, I think about releasing.
Yes.
And you mentioned a couple of things that I just want to go back to in
Mm-hmm.
case our listeners do not know what we're talking about. So you mentioned like circulation, lymphatic, fascia. So very briefly, without going into a lot of like technical
Yes.
description, so can you explain to our listeners perhaps when you think about circulation versus our lymphatic versus our fascia, what is it that we're talking about? And why is it that it's important to address these components of our body
Mm-hmm.
with the massage?
Yes. So I think it's important, just I guess an analogy could be like our car. We have to go get oil change. We have to do maintenance on the cars. We have to make sure the fluids are new, the fluids are processing through to get the car going. No one wants to be
Mhm.
driving down with a squeaky. You're driving and the car is like super squeaky, really loud, and you're like, oh my God, is that me? It's a little embarrassing. And so I think it's similar to the body. Our lymphatic system helps to clean out anything in our bodies that are toxins in our bodies. And so getting that going is important to just make us feel better. Same with our circulation, our blood circulation, making sure our tissues are getting the oxygen that they need. And that's going to help us feel better as well. And then with the fascia, it's just like that layer. There's like a layer over our muscles. And when that is limited, it's going to limit what mobility our muscles can do, and that's going to limit like what we can do or what we feel. And so I think that's what I love about massage, is getting to loosen up those areas and having the person just feel either a lot lighter or with a little bit
Mm,
more mobility when they come out of a massage.
I like it. I like
Yeah.
the word lighter
Mm-hmm.
because, again, goes back to this releasing.
Yes, yes, yes.
And sometimes we forget, like the book is titled The Body Keeps the Score. There is a lot that goes on in our daily lives
Mm-hmm.
is that I think that it can easily stay in our bodies,
Mm-hmm.
right?
Yes.
Of like stress,
Mm-hmm.
feelings, situations, emotions. And
Mm-hmm.
I like that this is a healing modality
Mm-hmm.
that actually addresses what's going on in the body.
Yes.
Yeah.
Yeah, that's what I love about it too, because there's just so many things that you can help a person through, whether if it's some sort of like a physical ailment or an emotional ailment. Our bodies hold everything that we've been through.
Mhm.
Yeah.
Yes. So thank you for sharing that.
Yeah, of course.
Woman by itself, we go through a lot of stages in life because of how our bodies physiologically change, right? So at some point,
Hmm.
we get our first menstrual cycle for the majority of the women, which that means that then we enter reproductive age. With reproductive age, some women choose pregnancy,
Hmm.
and pregnancy by itself brings a lot of changes in the body
Yes.
and changes that can feel very uncomfortable,
Hmm.
even that those changes are bound to like a time frame.
Hmm.
So when we talk about massage in the prenatal stage, right? So when moms are expecting, when the fetus is inside mom, how is it that massage can help them manage those changes, manage perhaps the pain, or even for some women, the changes that might be taking them as surprise in their body,
Mhm.
like, oh my God, what do I do now?
Yeah, yeah, yeah. Yeah, I think massage is a good way prenatal massages are a good way for, these moms to just take that time to just connect with their body and connect with all the changes that are happening, especially if it's their first pregnancy. And they just obviously, they can be as prepared as possible, but then when you're going through it, it's like your own journey. And so I think with the prenatal massages, they're able to feel the areas that I'm targeting, especially with the hips and the thighs and some of the low back, where a lot of those physical changes are happening, and get that relief, the release and the relief of the tension points that are stretching there, the muscles that are changing or that are adapting for the body to hold the pregnancy and to hold the fetus, and just getting to target those areas during their massage, and just seeing how they come out after, just being like, oh my gosh, like these areas feel so much better.
They have probably more mobility.
Yes.
And it can help with that pain management, right? The
Yes.
discomfort. And as you were mentioning the release and relief, I also thought about so pregnancy for every woman can bring different experience
Mhm.
and different emotions.
Yes.
And for some women, those emotions, I'm not going to use the word, I don't want to use the word negative, but they can be more powerful,
Yes.
stronger emotions
Mhm.
that could be related to loss. And the loss of how their body is changing, and also maybe of how their lifestyle and
Yeah.
what they used to be able
Mhm.
to do, whether because their bodies were able to do it or because they have more time, they were sleeping better,
Mhm.
then have to go, for example, to their doctor's appointment, can also bring some struggle in terms
Mhm.
of they might be happy because, oh, I'm pregnant, I'm going to have a baby, and they're preparing the baby's for
Yes.
all of this expectation. But at the same time, they might be holding the tension of the other things that they have to let go of
Mhm.
because of this change in their life. I think that the massage by itself, when you talk about the release and the relief, can provide them again like a framework and a safe space
Mhm.
where their bodies can also release maybe some of that emotional
Yeah.
components that are going on. What do you think about that?
No, I think that definitely is very much the case. Like, I definitely have had during the session, some of them mentioned just they're excited, but then there's also the duality of the other side of they're just also like freaking out because they're like, what's gonna happen? What's gonna happen to me? And I think the massage give them a chance to just momentarily maybe forget what's going on so they can just de-stress, because I think a lot of that happens as well during the prenatal phase with family things, prepping for baby, even work. Like some of them are still working up until they're due. And so they're feeling all of those emotions they're feeling, and it's hard. And so I think with the clients that I've had to do prenatal, I love that's something that they're honoring within themselves, is this either 60-minute, 90-minute time frame that they just get to have someone take care of them.
Yeah.
Yeah.
And
Yeah.
I think that's also very important. And
Mhm.
especially as we go into the postnatal,
Mhm. Yes.
is I can come to this place where I am going to be able to relax, even take a nap,
Yeah, yeah.
because sometimes they're sleep deprived, and
Mhm.
somebody else will just nourish me
Mhm.
in a way that is every human being needs it, but especially first time moms that
Yes.
again are getting adjusted to taking care of this child, this baby,
Mhm.
that it requires some of their time and energy and effort, and they're not going to be sleeping, which for me, sleep is like that like
Yeah.
thing that is, if we can get you to sleep, a lot of things in life fix
Yes. Yes.
just by being able to sleep well.
Yes. No, definitely.
So
Um,
since we started to mention just the postnatal stage after they have had their baby,
Mhm.
which, correct me if I'm wrong, but I'm guessing that maybe the approach to massage or maybe how soon they might be able to have a massage might be a little bit different if they have a vaginal delivery than a
Yes.
C-section.
Yeah.
Just because I'm thinking the C-section, it takes a little bit more time to heal, pain
Yeah.
management, all that kind of
Yeah,
stuff.
and we wanna make sure the scar is fully or, like, the opening, the incision is fully healed before initiating any type of massage.
Yeah.
In those cases, yes.
Yeah. So tell us a little bit then about that. Tell us a little bit about massage in the postpartum phase, but then
Mhm,
how would you approach it if it's a mom that had a vaginal delivery versus a
mhm,
mom that had a C-section? And I might be wrong, but I'm
mhm,
guessing that perhaps there might be also some considerations if they're a first time mom and they are trying to breastfeed for the first time. So tell us a little bit more about the benefits, how it can help
mhm,
them, but then what would be like a different approach for these type of women, these type of
mhm. Yeah. So I think we could start with approaching. So if it's a C-section delivery, we wait a few weeks until the scar is full, until the incision is healed. And then from there, something that I do with my postpartum postnatal clients is just making sure however I position them on the massage table is what their
Mhm.
preference would be or their comfort. So if they want to stick to a side lying position because maybe they're just not fully confident in laying on their stomach just because either of the incision or breastfeeding, there's a little bit extra there. And so they don't want to put pressure on those areas. And so we'll stick with a side lying position and still address. I do a lot of just Swedish, what I call Swedish techniques, which does a lot of encourage the circulation. And then also just focusing a little bit more on trying to bring the chest up, the back, the shoulders, the arms, because now they're like carrying baby. They might be like a little bit more hunched over sometimes if they're breastfeeding or even just trying to hold. There's a little bit more pressure up in the upper body. So focusing a little bit more on addressing those areas. And then with a vaginal delivery, it's for that one, it's whenever the mom is comfortable to come in for a massage. That's when we can do that. And same thing, I always communicate with them. Okay, you're able to lie face down. Obviously, I put like support, there's like breast pillows where it has like a little bit of a indentation, so they could feel more comfortable. But same if they're like, you know what, I want to stick with the side lying. I'm like, yeah, like that works for me. And same thing, just focusing a lot on that upper body since they're probably like hunching over. They're probably have like head or neck in a weird position as they're nurturing baby.
Yeah,
Yeah.
of course. And I think that even the carrying of the baby, the
Yeah.
strain
Yeah.
for some women when they're starting to breastfeed, the engorgement or how the breast changes, that
Mhm.
can also create that change in the form
Yeah.
that might
Yes.
start to provoke strain and pain. Uh,
Mhm.
so I think that addressing all of these things is really important. And I know that maybe the listeners are thinking, am I even going to make time for this?
Yes.
In the midst of having a newborn coming into the home, and again, the changes that brings
Mhm.
through their lives, that if you are talking to this lady that is thinking, oh, this sounds wonderful. Like,
Mhm.
how am I going to make time for this? And who can take care of my baby? And all of these like
Yes.
challenges and obstacles are just going through their mind. Perhaps what are some words of tenderness and compassion that you can give them that will help them see, you know what?
Mhm.
Something that perhaps, yes, you do want to, even if it's just like once a month, and
Mhm.
you can tell us what you recommend in terms of how often, both for the prenatal and the postnatal. But what would you tell this woman? What are some words of tenderness and compassion that you think these women need to hear?
Yeah. I think the most important thing is we cannot take care of others, especially our baby, if we're not taking care of ourselves and making sure that we're and acknowledging that I'm important too. I need love, I need nurturing, I need someone to help me feel better. And sometimes we have to look out, we have to look for that outside of like our family circle. So like our family circle can help us with taking care of the baby, and you can find someone that you feel comfortable with to go get a postnatal massage, to then you can come back and then have even more energy, a little bit better, a clearer head to be like, okay, what does my baby need now? What does my family need now?
Yes.
Yeah.
And I like that you mentioned inviting somebody that is not your family, like a friend.
Mm-hmm.
And the reason that I'm thinking about that I like it and I think about it is so it's like a double dipping
Yeah.
where you go for a massage, but then at the same time, in the midst of all the changes and all the demands that having
Mm-hmm.
a baby starts to create, then you also make time for those relationships that
Mm-hmm.
nourish you.
Yeah.
And I think it's not that family members are bad. I just think that um friendships can nourish us in such a deeper way. And especially if it happens to be that that person, your friend, perhaps if you were a new mom, maybe that friend has had one or two kids. And then it can also become this mentoring relationship.
Yeah, like your community.
Yes. And somebody that can give you some insight.
Yeah, because that's important. I think just learning from other moms. That you're not, I think, I don't know if there's this misconception of the mom should know what to do the moment they get pregnant. And it's, you don't have,
Right.
it's a whole learning curve.
Yes. And I was another guest in my podcast,
Mm-hmm.
I cannot remember who it was, that we were talking specifically about how sometimes women can feel the guilt because there is this silence expectation of once you become a mom, once you become pregnant, that mom instinct is supposed to kick in. And all of
Mm-hmm.
a sudden, you're supposed to know what to
Yeah.
do. And you're supposed to understand what all the cries mean. And
Yeah.
all of a sudden, you know how to breastfeed and it works
And then,
magically and
yeah.
life is happy.
Mm-hmm.
The reality is that is not the case.
Yeah. Yeah, definitely.
It is this learning curve.
Mm-hmm. Mm-hmm.
So, especially for first time moms, if you have been put on the pressure of the mom instinct has to kick in and you're supposed to know exactly what to do and how to do it, and life should be perfect, uh,
Mm-hmm.
that is not the case. You don't.
Yeah.
You don't.
No.
Let's take that stress
Yes.
away from it. Yeah.
And even I feel like even if you like do all the classes before, read up as much as possible, it's still going to be a learning process. And you're still going to need and should seek out that help from your friends, as if that's who you have, as well as families
Yes.
or outside
absolutely.
resources. There's so many out there, and just trying to find them. And there's so many people that want to help.
Yes. Word of
Yeah.
mouth always is
Yeah.
better than you Googling
Yeah.
and looking on social media and trying to figure it
Mm-hmm.
out on your own. You can always ask. So, as we come towards the end,
Mm-hmm.
I want to go back into the practical.
Mm-hmm.
So, for women that are listening to us that maybe they just found out that they're pregnant, or again, this is their first pregnancy
Mm-hmm.
and they don't know what are the resources or how this can really help me to go through the changes that are
Mm-hmm.
happening to my body, not only physically, but also emotionally and mentally. So, why should they consider massage?
Mm-hmm.
What would you recommend in terms of the rhythm or the consistency or how
Mm-hmm.
often they should do it? And three, I think that again, this is really important and different for
Mm-hmm.
every woman. How could they also find out, maybe perhaps without having to risk completely, if this is a good massage therapist for me? Are we going to be able to
Mm-hmm.
have like a good relationship?
Mm-hmm.
So, going back to those practicals, what would you tell our listeners as they start to think, oh, maybe I should consider this as part of my
Mhm.
routine?
Yeah. So I think if it's their first pregnancy or even just any pregnancy, the recommendation is 12 weeks before you can start getting prenatal massages. And if you just want to be a little bit more clear on that, you can also at the 12 weeks just get clearance from your doctor for massage because there are some instances in which massage isn't recommended. And so we just want to make sure that you are following a plan that is recommended by your doctor just to make sure everything goes well with your prenatal journey. And in terms of frequency, usually from what I've seen and recommended, some of them will come in like once a month during the second trimester and maybe up to 1 to 2 times a month during the third trimester, since the third trimester is where more of the physical changes start to happen, as well as getting ready for however their labor and delivery is going to look like, making sure that at least physically those muscles are a little bit more relaxed helps a lot during that labor and delivery journey. And then for postpartum, postnatal, same thing. If it's just once or twice after giving, like when the couple months after giving birth, and then from there you can transition into once a month or once every couple months, depending on just your daily life. And I think what's important for to look for in a prenatal massage therapist, I think is like what I said for just any massage is making sure that they're listening to you, making sure that they're addressing like this is what I feel in my body and this is what I want you to work on. And this is what I like in terms of pressure as well. Because I think that's the big thing. Like you don't want to be uncomfortable or feeling things are uncomfortable during your massage. And I think for me, with my experience, I do prefer putting my clients in the sideline position. So if you have a preference there, it's something to also look in because I know they do have some tables where there's like a hole kind of cut out. And so some will do like a face down, but it just depends on if you prefer that versus sideline. And I think in terms of just like how the massage should feel or what they're working on, I think for sure they're targeting your thighs, your hips, your lower back to help release and soothe those muscles. If there's anything that you're feeling with your legs as well, just because they're holding a lot of the weight as you're walking and doing your daily things. And so making sure that as they're addressing those areas that you're feeling relief and that you're
Mhm.
feeling the muscles being released from the tension that they're holding, I think is super important.
Yeah, so
Yeah.
thank you for sharing all of those details.
Of course.
I am going to go back to one thing that you
Yeah.
said, which was you mentioned clearance from your doctor.
Mhm.
So I am guessing that what you mean by that is so at 12 weeks, they're already under their care of an
Mhm.
obstetrician. And I think that what you mean by that is that their obstetrician has told them that there is nothing going on in terms of the pregnancy,
Yes.
that there would be a contraindication for
Mhm.
to engage in massage or maybe other types of modalities like yoga or Pilates.
Yeah.
For people that are listening and are curious like me, do you know what some of those contraindications could be?
I think one of the most common could be if there's like a very serious, like a higher blood pressure than what's typical during a
Oh, because
prenatal.
they're laying flat.
Yeah, because they're laying flat. And then obviously with the massage, like you're increasing circulation.
Mm.
And so obviously we know like you are holding more blood in your body. But I think there is I'm not sure right now, but there is like a threshold, like a higher threshold where it does become more of a risk than a benefit.
Okay.
And then I am not sure right now, but usually when I do my prenatal form, I do
Mhm.
have like anyone doing a prenatal massage should have it listed out. So on the forms or when you go to them to do the consultation, should have a list of what are some
Preg-
patients for prenatal.
Specifically
Yes.
for pregnancy.
Yes, yes.
Which I'm wondering, and if it's okay if you do not know, don't
Hmm.
worry. I'm wondering if some of those could be related to where the placenta is.
That's what I'm assuming is just probably like just the positioning of that.
And so curious, since you
Hmm.
mentioned blood pressure, that would also mean that a chair massage would also be contraindicated. Because even then in the chair massage, they're not laying flat, you're
Hmm.
still moving the
Yeah.
circulation.
And yeah, with any massage, like that's the point that's like the main thing that you're trying to do. You're trying to get the blood flowing. And so, yeah, the circulation increases. And even with any typical person, usually if they have untreated blood pressure, that's a contraindication as well.
Okay. Awesome. Thank you for sharing
Of
that.
course.
Yeah. So sorry if I put you on a
No, but it's important. But it's important to know and to know about.
yeah,
Yeah.
absolutely. Oh, tell the listeners how they can find you if they heard anything here in our conversation that they go, oh my God, this is so awesome. I want to get in contact with Amada.
Yes. So I do have a website. My website is www.massagebyamada.com. And with Amada, it's spelled AMADA. And then I also have an Instagram page. So it's at Massage by Amada for the Instagram.
Thank you. Great.
Yeah.
And I will put that in the show
Awesome.
notes.
Okay.
Yes. And I do know also that you have, for our listeners specifically, if they want to work with you, you have a special like offer. Do you want to tell us a little bit?
Yeah. So I want to do just any listeners out there for Dr. Maria, just a 50% off coupon. And so you could just use the code Salud Revisited, and that'll give you the 50% off.
Awesome. Thank you. And again, I will put that in the show notes.
Yes.
You don't have to write it down. It will just be in the show notes, and then you can contact Amada.
Yes.
So as we come to an end, is there any last words of wisdom or inspiration, anything that you want to leave, not lead, but leave our listeners with?
Yeah, no, I think massage therapy is such a beneficial service to incorporate into your daily life. It could be once a month, it could be twice a month, or it can be even just once a year at least. And I think it's something that you haven't tried. Try starting with the chair massage, try starting with just like a 60 minute. And even some massage therapists I know even have like consultations before. So even for me, like if you would rather book a consultation before doing a massage just to meet me or talk to who is your potential massage therapist, I think clears up a lot of confusion and increases that confidence in the service and the benefits for it.
Yes. And again, the relationship, right?
Yeah.
Is this somebody that I would let them touch my body?
Yeah.
Absolutely. Well, thank you, Amada, for being here.
Thank you for inviting.
Yes. And spending some time with us, talking about all things massage, specifically for women during their prenatal and postnatal journey.
Yes.
So thank you for being here. And to all of our listeners, thank you for listening. If you find that episode helpful and you know of just one other person, just one other lady that she needs to listen to this because this will help her, share the show with them. Just send them a link of the episode because I know that just as you benefit, they will benefit from information that was shared here. Until next time, ladies, thank you for joining us. Bye.